Was reconstruction.
Well, tonight we're talking breast health, and we're joined by Dr. Michelle Townsend-Watts. Thanks so much for coming in the studio. She's the chairman of radiology at MedStar Good Samaritan, as well as MedStar Union Memorial. Thanks for coming in.
Thank you for having me.
So talk to us about mammograms. When should you start getting them?
So you should start getting your mammogram at the age of 40, no later than the age of 45. And that's for patients at average risk for having breast cancer. Now, there's some patients who have an increased risk of having breast cancer, and they should start mammography at the age of 30.
Okay, and I was going to say, I just had mine not too long ago. Mammograms have changed. Different types of mammograms out there, different options you have.
They are. So currently we have digital mammography, which is our classical 2D mammo, and we also have 3D mammography, which is called tomosynthesis. And the 3D mammography allows us to get a better detailed look at the breast tissue, and it also decreases the probability that you have to come back for more pictures, which I'm sure everyone loves. And additionally, it does find more cancers.
So it's a better view?
It's a better view. It's kind of like you know what the inside of a book is based on the title, like Huckleberry Finn. But once you open the pages of Huckleberry Finn, you know what's actually in it. So tomosynthesis is actually looking at the pages of the book.
They haven't made them any more comfortable, though.
They have not.
That has not changed, and I don't anticipate that changing.
There's some technology that we can use in terms of what we actually use with respect to compression devices that might make it easier, as well as having mammo pads on the actual image receptor that you put your breast on. That might make the whole procedure less daunting.
It's quick, though. That's the good thing about it.
It is quick.
That's right, and definitely worth having. Talk to us about the difference between a mammogram versus an MRI or an ultrasound.
So MRI is what we call supplemental screening, and it's for those patients who have a greater than 20% lifetime risk of having breast cancer, those patients who have a genetic-based increased risk of having breast cancer, those patients who've had mantle radiation for Hodgkin lymphoma. We also recommend that they begin screening with supplemental MRI between the ages of 25 and 30. There's a new area of breast MRI screening for patients who have a personal history of breast cancer and have dense breasts, or patients who've had a history of breast cancer and were diagnosed by before the age of 50.
And if you've had breast cancer before, do you have to go back more frequently for your mammograms?
No, well, for the first year, depending on what type of radiation you have, it may vary between every 6 months for about 2 years, and then you go yearly. And after about 6 months, there's just an annual mammogram.
Okay. All right, doctors, thanks so much for coming in. The number to call, 410-481-2222. You got about 15 minutes left with our experts from the MedStar Health Cancer Network. Jamie?
All right.